Dr. Mark here at Natural Health. Tonight is our patient education workshop on the chiropractic side. Our topic tonight is bone on bone. What does that really mean? So you hear that all the time. We get patients coming in all the time talking about, oh, their knee is bone on bone. Well, they're walking on it yet. So it really can't be that. So what's going on in there? Well, um, it has to do with the joint and what's between the joint, and then how the body protects that joint. So in a little model of the spine that I have, this is looking at the lumbar disc area. The normal disc is nice and thick like that. It's nice and hydrated. So the ideal here is that the joint's working correctly in the back. The body can move correctly and get good motion in that disc area to get minerals and everything in there so that the disc stays hydrated. Before I go on, I should give you a little introduction and background. I've been here in the Natural Health Chiropractic Center. We've been doing this for 37 years. And we've always used activator adjusting, which we'll talk about here in a little bit. We do a lot of nutrition work here too. And just recently had my two sons, Dr. Chip and Eddie, come and help out. We'll talk about that in a little while. But just as a background to what's going on and why we see these patients who are talking about bone on bone. But anyway, back to our little demonstrator. As long as we get good motion in the spine, then the disc is nice and hydrated. But if the disc the body stops moving, those motion, it gets hung up in there because of a misalignment in the back, the disc starts to get flattened out or dehydrated or unhydrated, and it flattens. That makes it bulge. Well, the body then will put calcium around that disc. So to support that area, the disc is still in there, but when you look at it from the side, this disc is there, but it's hidden by the bone. So if you go on an x-ray and your doctor or whoever is showing you an x-ray and it's got that, it looks like it's just bone on bone, there's just bone there. Well, again, it's because the disc are in the knee, it's a meniscus, it's a different type of cartilage. In the hip, it's a cartilage there in the hip. So if you has arthritis around there, you won't see the disc or the cartilage there. So it looks like bone on bone. But again, like in the knee, if it actually was bone on bone, you couldn't move the knee. I mean, there would be no way that the bone would not grind terribly if it was just bone on bone. So there has to be some meniscus left. And that's why in our practice, when we see people come in the office with a diagnosis of bone on bone, then we find that after some adjusting or nutrition or whatever it takes for that person, all of a sudden the pain is gone. And would that have happened if it was actually true bone on bone? No, I don't think so. So we've had many patients over the years get just permanent relief by doing what we do here and not needing surgery. You can always do surgery. Surgery is something that you can do, and some people definitely need it, and some people are bone on bone. But most people that get the diagnosis are not really that complicated of a case. So that's just a little explanation. Another word that comes up often is slip disc. So people, they go to the whoever and they say, oh, I got a slip disc. Well, the idea there for us is that a lot of people think this is like a hockey puck in between the vertebra, and it's not. It's a very fibrous tissue. That disc cannot slip. The vertebra will actually break before that disc will pull out. So it's a very fibrous tissue. Now, what happens, if anything, the disc will flatten, it gets bulging, and then if that bulging area gets weak, the inside will come out of it, and that's called a herniated disc. So that's totally different than a slip disc. So in the chiropractic world, we're looking at these joints back here that get misaligned, and that's how, when they get stuck out of place, the inflammation around that joint or from the bulging disc irritates that nerve and gets into problems. So that's our little discussion on bone, and slip disc on the bonus word there. So what we'll go ahead and do now is just go through some of our handouts here tonight. And on our little high-tech presentation board here, we have what we call dis-ease as one of the triangle points, nerve interference, and then loss of function and pain. So many folks come into the chiropractor's office with pain, and chiropractors are well known for being able to help neck and back pain. And we do a really good job of that. That's the loss of function and pain. If the function is lost long enough, we get enough deterioration, then it becomes this scar tissue bone on bone thing. So the idea there, because with the loss of function and pain, the pinching on the nerves, then we have nerve ear interference. The body cannot get the organs and glands to work correctly. So then we have dis-ease. So not like a disease process, like you're thinking of a medical prognosis, but just not the body working correctly, dysfunction and dis-ease. So our goal then is by removing the nerve interference and fixing the loss of function, of course, getting rid of pain, we get rid of this dis-ease. We get back to normal function in the spine, normal function in the body. So in our little handouts, if you come to our office, we give the patient some pamphlets. This one called the New Patient Pamphlet. It goes into explanation of more about the nerves and the disc areas. It's a very good little pamphlet, quick information. And then we use a technique in our office called activator methods. We'll talk about that in a little bit. So we give those to the patient, trying to educate our patients. Then one of the big handouts we show patients a lot, this one is called the tip of the iceberg. Our pain is the tip of the iceberg. You can see where the pain is the very top part here. That's where people a lot of times come to our office because of pain. But we're working on a lot more than just the pain, the subluxation area. Again, what I showed you on the little spinal model with the nerve interference. That causes nerve interference here, and that causes the loss of function and pain. All these problems underneath. And this can lend towards all the disease, not only the dis-ease, but disease states. Because again, the organs and glands are not being supplied by nerve supply correctly, and they cannot coordinate their efforts with the brain, the functions of the body that have to do with healing. So very important to realize that the pain is like the light on the dashboard of your car blinking. Something's wrong. So we want to get that gone. We also want to get the blinking gone. That's the pain, but get the underlying problems gone so we don't have more and more problems later. Let's go to our next high-tech presentation board. In our office, we use some techniques to adjust the spine. The activator, diversified techniques. Activator is a real light force way of adjusting. This is called an activator, and this one has a battery. So it's a real light force way of adjusting, and we can adjust patients with this and actually sneak the vertebra back into place. It's just a real easy light force adjustment. So that's all there is to it. It's a real simple adjustment. It works very well, and we can just, again, get the vertebra line back up, get that function back into that motor unit area of the vertebra, and get that disc start to rehydrate so that it can start moving correctly, getting that bone off bone, getting that disc to rehydrate and spread apart the vertebra. There's also some other techniques we can use. Diversified is just a technique that kind of helps us to move all the different bones, but we normally do very well with activator, and we're Palmer graduates where we came from the Fountainhead, actually where chiropractic started. When we do our testing, it's designed for your needs. So we do leg length checks in our office, and that way we can figure out what exactly or where exactly that patient's problem is. So we try to avoid x-rays, the expense and radiation of x-rays unless they're necessary, and we can figure out using our leg length checks where to adjust at and where not to adjust there too. So with activator, the light force type of technique, we adjust patients who have had disc surgeries before. We adjust babies, old people with osteoporosis, all kind of, about anybody really. We adjust patients sitting down if needed to, even in wheelchairs. We can really get into any problem or any patient's problems they have, and get that spinal nerve working correctly again. So again, the body can get back to normal function. a couple more handouts that we have to go over. This is a one called the criteria for healing, the phases of healing. So when patients come in, again, if you're thinking about pain only, a lot of times people will think that when you get rid of the pain, they're good. The pain's gone, so it must be good. Well, no, it takes a while for the ligaments to heal. Ligaments take from 6 months to 2 years to heal, like a sprained ankle. When people have a problem in the spine, that is a ligament that has gotten loose over time and is causing the pinched nerve. So again, it takes some time for ligaments to heal, to get the body really well. Pain relief usually comes very quickly, within 2 to 6 weeks. But to get a good spinal motion and good spinal stability, it takes some time for that to happen. So we have phases of care we watch to get that figured out. We also have some common exercises that we have patients do. There's just stretching exercises that help the body, and we just work with that when we get into the rehabilitation building part of the program of the phases of care, and getting again the ligaments to heal up and the muscles to relax. Another point that people need to realize: if you're having massage, if you're having physical therapy, things like that are great, you do really well, but the muscles will tighten back up if the nerve is irritated. So you can get the muscles worked out, but it's the nerves that control the muscles. So it's important that we do the chiropractic work too, that we remove the normal or the unnatural nerve interference to get those muscles to stay relaxed and to balance in the spine. So many people have an overactive area where the muscles are too tight. A good example of that is people who have knee problems and are given a diagnosis of bone on bone. Many times it's a problem in the lower back. The nerves are irritated, over tightening the muscles in the leg, pulling twisting, putting a twisting pressure on that knee. So when the knee is supposed to be going forward, it's actually pulling to the side, and that unnatural pressure there is what wears on the meniscus. So by reestablishing normal function and position in the lower back, the hip, pelvis, and knee, a lot of that swelling and inflammation can go away. There's ways of actually rebuilding that meniscus. So important to realize that the body is meant to be well. It's not meant to be sick. It's not, your body's not meant to just age and fall apart. The body can be well and stay well, and you just have to have help sometimes, especially in our fast-paced lives, in this society, and the nutritional issues that go on there. On our spinal nerve function chart, this is a little chart that goes into which areas of the vertebra the nerve comes from, and then goes into which organs and glands. So all these handouts are available in the office too, if you come to our education workshops. But for instance, one that we find really commonly, T6, the middle, kind of under the shoulder blade area, that goes to stomach and upper abdominal or upper intestinal digestion areas. So a lot of people have any kind of digestive issues will have a T6 vertebra misalignment and some what we call subluxation. So if that gets out of place, you just keep having stomach issues. So the interesting thing we found is that the vertebra going out of place can cause a stomach issue, or persons that eat stuff that cause the stomach to have problems will make the spine go out of place, kind of like a breaker. So in a breaker box in your house. So we try to balance all these things as we go through a patient's care. So this is an interesting chart. The next one here is very similar, but then it has, and I can show you that, but then it has with it the standard processed nutritions that go along with that organ area to try to get it to heal. Because again, the spine being out of place can cause the organ not to work, the organ being out of place can cause the spine to have problems. So you do a lot of nutrition to help both areas there. And that works very well. The need for nutritional support. Another handout with chiropractic care. There are certain things we use for the organs, and then certain things we use for the ligaments. So people that go to chiropractors, they find that if they have to keep going back all the time, it's not the chiropractor's fault, it's the ligaments that are weak. So then you can use nutrition, special nutrition for those ligaments to get those to heal and stabilize. Now, it's always good to be checked chiropractically somewhat often, just to make sure you're in good shape, just like you would have the oil checked and changed in your car and have your teeth cleaned, those kind of things, just periodic checks, because again, riding in cars, bouncing around, all the work we do, watching TV, bad posture, things like that, allow these vertebrae to go out of place. And again, because of the ligaments that get weakened. And so that can cause a nerve interference, again, going into the disease and those kind of things. So we'll go to our last chart here. And again, as I showed you on the painted as the tip of the iceberg handout, we're looking at overall health in chiropractic, not just the pain area. Again, patients think that it's just for pain, which again is a good way of starting, but to understand that that is not near the whole picture. Chiropractic can help with all types of problems by getting the nervous system to work correctly. Now, there may be other things needed to help too, but chiropractic is a great way to help the body to heal normally, as it should. It's always meant to heal itself over time. So we work on overall health. And then with the activator adjusting, it's safe and painless. The activator is just a real light force way of adjusting. So it's just painless, very simple to do. We try to avoid all that noise that goes along with some of the osseous forms of adjusting. We've found that that's very easy for patients to work with. Many people who are in pain come in and they just really can't hardly move much. So trying to make them move more just causes more pain. So with activator, you're nice and relaxed, laying flat on the table. We're using leg length differences to check and just adjusting the areas that need to be adjusted. Very easy. And we do quite a bit of muscle work in the office too. So now something I forgot at the beginning, if you do have a question, you can put that in the comments there on Facebook, and we can answer questions for you too. I won't have much time, but if you leave them on there, we'll get back later. Also, since you're taking the time to watch this tonight, we have what we call a public education workshop screening form. And what this is, if you come to our workshops personally, we give this to patients and actually do a small screening exam right now. We do that for free since you're spending your time to see what we're up to. Since you're watching, if you're watching on video, then the secret word is spine, S-P-I-N-E. And if you come into the office, we'll still do the free initial screening just to show you what we find. Because many people, I'm always surprised, have not been to chiropractors, and just don't understand what we do. So if you want to do that, just come in. There's no cost. You just see what we find, and then we do a reported findings, and then we go from there. But at least let you see that if there are chiropractic problems there, and if there are chiropractic problems there, we're really the only people that can help with that. There's misalignment issues. That's our specialty. We can help with that. So I'd love to help you there. Good. Our last little handout that we have, little triangle, but this looks at our office particularly in that we address the three sides of true natural health. We work with the physical trauma side, which is the chiropractic adjusting side, the biomechanical side. We work with nutrition and toxins, getting toxins out of the body and getting good nutrition into the body so the body can heal, has the building blocks to heal. And then we also work with the emotional thought issues. A lot of people have a lot of emotional problems from past pains and agonies and traumas. And we found that if we can get that under control, get those correlations removed, then the spine stays in place better, the body can heal better, your stress levels lower, anxiety, depression, all those kind of things start to melt away. So we've found that this is a really good way of looking at the whole body, and really works well. So if you think of any questions, again, you're welcome to put that on the comment side and we'll try to answer those, or you can get on our website, naturalhealthquincy.com, or just call the office. I'm happy to answer questions. And again, the secret word is spine, S-P-I-N-E. So if you're interested in a free exam, come in, just give us that word and we'll do that for free. Otherwise, you're always welcome anytime. So enjoy your evening and try to stay cool. We just want to help you to be healthy. So thanks a lot. Bye.